A warm greeting of the day, everyone. Hello, everyone. My name is Ilyas Devan, student of BHC Radiology and Imaging Technology, third semester. Welcome to my learning video on the topic chest X-ray interpretation and clinical importance. In this video, I will discuss a research paper related to chest X-ray finding along with case study, book reference, and short lab demonstration. According to the research paper titled Diagnostic Value of Chest X-ray in Detecting Lungs Disease, the chest X-ray is one of the most common used imaging technology in hospital. Helps doctor detect phenomena, tuberculosis, heart element, lungs tumor. Now let's look at the highlighted portion of the research paper. I am sharing the screen. Few-shot learning (FSL) method aim to addresses those challenges by designing models that can be trained using a small training dataset. Now I am stop sharing my screen. This means that deep learning modules usually needs a lot of data to work well, but few-shot learning (FSL) helps the modules learn even from a small dataset by dividing the learning into small steps or episodes. Each episode helps the modules improve, make better prediction with limited example. Each episode helps the model improve and make better prediction with limited examples. The research paper shows that FSL can be applied in chest X-ray diagnosis, usually where large datasets are not available. Let's look at the first case. A 45 years old male patient came with cough, fever and chest pain. Now I am sharing screen the showing case study videos. X-ray showed pathway opacity in the right lower lungs zone, indicating phenomena. With proper antibiotic treatment, the patient recovered completely. Now I stop my screen share. In the second case, a 60 years old smoker complained of short of breathness. He says I am sharing my screen and showing second case video. His chest X-ray showed a marked shadow in the upper lungs area, which was later confirmed a lungs cancer. This shows how chest X-ray helps in early detection and diagnosis of serious lungs disease. Now I stop my screen share. According to the textbook of radiographic positioning and related anatomy written by William F. Hope, chest X-ray is usually taken in posterior anterior PA view to reduce heart shadow magnification. Support the research paper's idea that proper technique and clear image are important for accurate diagnosis. Now I am sharing my screen and showing all of you reference book chapter with alveolar filling infrared in the right middle lobe. Note the positive in the right heart border in the PA posterior anterior projection. The yellow arrow indicated the without alveolar air space, reducing a slight band of consideration in the patient who luckily had some associated metastasis of right middle lobe as well. Few shot learning method can diagnose chest X-ray image effectively even with few training smalls and can handle variation in the disease presentation. Clearly shows that few shot learning helps improve chest X-ray diagnosis when only a small amount of data is available. Now stop my screen share. How a chest X-ray is done in radiology lab. Now I am showing a lab demonstration video. I am standing in the radiology lab, and firstly I introduce some radiology lab instrument. Firstly, X-ray table or bucky, X-ray tube, control console unit, lead apron, and other equipments there in the radiology lab. Explain the process so the patient feels comfortable. First, the patient remove all materials like chain or bottoms. The patient stand facing X-ray cassette. Shoulders are rolled forward for a clear chest image. We ask the patient to take a deep breath and hold it while taking the X-ray. We expose the X-ray and the X-ray image appear on the X-ray cassette. We check it if it is clear and send it to the radiologist for report. Chest X-ray is simple, safe and painless. It helps finding problem like pneumonia, heart disease. Let me stop my screen share. Conclude, chest X-ray play a very important role in the detecting and monitoring many chest conditions. Through this research, case studies and demonstration, we understand how theory connected with the practical radiology. Thank you for watching my video.